It develops over time.
Hello guys, this is Cykaniki. Today I will be attending one of the events here in Cebu. So be with me. I'm going to show you, or I'm going to bring you with me. I hope you're going to learn. It's very educational, I tell you guys. So hopefully you can learn something from this vlog as well. Okay, so see you soon. Bye-bye.
Hello! Welcome to Cebu!
Si Jackie.
Siya! Nice
Siya.
meeting the Cebu vloggers!
Yes, thank you for inviting us.
Yeah!
Kasi new friend ko si Esther.
Hi.
Yes, beautiful. At si Rika. Hello, beautiful ko. Yun siya. No. At ang ginsal namin sa Cebu.
Thyroid gland is a small butterfly-shaped organ found in the anterior part of the neck, which is part of our endocrine system. Its function is to take iodine found in many foods and convert it into thyroid hormones, which is necessary for all your body functions. And these are breathing, heart rate, menstrual cycle, body weight, body temperature, muscle strength, central and peripheral nervous system, and cholesterol levels. These hormones are called T3 and T4.
Meron din pong interaction ng thyroid hormone dyan, and to maintain the contractility of the heart and the blood vessels as well. And of course, kidney po. May kidney function din po siyang influencing the kidney for fluid regulation and water retention. Sa liver, ito po yung about sa cholesterol metabolism. Sa intestines po or ating gut for absorption and motility, bowel habits. And of course, importante kasi lahat mostly female and dito, it has an influence on the female reproductive system such that it can influence fertility, okay, our menstrual cycle. So ito po yung nagde-drive one of the hormones, kasi marami po ang hormones na playing interaction for a normal menstrual cycle every month. So that yung thyroid hormone po, meron po yung influence sa menstrual cycle sa ating mga babae. And of course, if magbuntis, meron din po yung importance ng thyroid hormone for development of the baby, especially brain development. Simple goiter, pwede din pong iodine deficiency disorder, magkakabosyo din po doon. Hyperthyroidism, or kasobrahan ng thyroid hormone. Hypothyroidism naman, kakulangan ng thyroid hormone. Ito po ba lahat ay nagkakaroon ng bosyo? Yes. Okay? So, ang bosyo or goiter is a general term for a person na may nakikitang noticeable enlargement sa anterior neck or sa leeg na part. May it be simple, goiter, hypo, or hyper, hindi po natin alam. Aalamin yon through the TSH and FT4, yun po yung nakukuha sa blood. So, iba po ang goiter ay architectural kakaibahan sa hugis po ng thyroid. Yung iba, may autoimmune thyroid disorder or antibody laban sa thyroid. Minsan, napupukaw po ito kapag sila ay under stress, magkaroon ng bosyo, either hyper or hypothyroidism, or kung may problema sa pituitary gland. So, pangangailangan ng iodine, ito po ay ang normal requirement ng pangangailangan natin ng iodine araw-araw. Okay? So, about 100 to 300 micrograms araw-araw ang pangangailangan ng iodine ng katawan natin para maka-release or makagawa ng enough thyroid hormone that we need for our body. Okay? Masamang dulot ng iodine deficiency disorder, ito ay, of course, nasabi ko kanina, nakakabobo or nakakabagal ng pag-unlad ng utak. Ang ginagawa ng DOH hanggang ngayon, yung campaign for salt iodination.
Hypothyroidism. So the signs and symptoms for this are hair loss, inability to think clearly, goiter or enlarged thyroid, reduced heart rate, sensitivity to cold, dry skin, weight gain, puffiness, memory problem, constipation, irregular menstrual periods, severe PMS, depression, mood swings, joint and muscle pain, and high cholesterol. And if you're hyperthyroidism or you have too much T3 and T4, these are the signs and symptoms: hair loss, bulging eyes, goiter, heart palpitation, tremors, heat intolerance, sleep disturbances, weight loss, shortness of breath, diarrhea, increased appetite, irregular menstrual periods, muscle weakness, sweating, anxiety, nervousness, depression, and mood swings.
So yung levothyroxine, ito po yung thyroid hormone mismo. Hindi po yung raw, kasi yung raw material iodine po yun. So that, yun po ang ginagamit at binibigay natin sa mga patients na hypothyroid para po mag-normalize ang thyroid hormone nila. Hyperthyroidism naman, from the word hyper, kataasan or kasobrahan ng thyroid hormone. So kung sobra yung thyroid hormone, matidetect yun ng brain na sobrang taas yung thyroid hormone, hindi na siya mag-stimulate. So sabihin na niya, I will stop stimulating. So hindi na din siya magre-release ng TSH. So kaya kukuhanan ng TSH ang pasyente, mababa or mataas? Mababa, kasi hindi na nga siya nag-stimulate. So they also go opposite na naman. Kapag ka mataas ang thyroid hormone sa katawan, bumababa ang TSH. So kaya yan po yung nagiging or nangyayari sa dumalaki yung leeg. Kasi ang other term for hyperthyroidism is overactive thyroid gland. Kadalasan nakikita sa mga tao na mataas ang radiation, yung iba lahi, edad 40 pataas at matay, tapos mag-radiation and mag-replacement ng thyroid hormone. So, ito po yung mga examination kung paano i-examine or evaluate ang posyo or goiter. Kaya po na-mention ko kanina, ito po yung blood test para sa pag-assess ng function. Ito po yung ultrasound para makita kung meron man or walang bukol or architecture ng thyroid gland. Etong thyroid scan, pwede din itong gawin. And ito, yung na-mention ko kanina, thyroid na fine needle aspiration biopsy. Okay? Yun nga po. So kapag nagpa-check up ka, ang gagawin natin is titignan natin. Number 1, ipa-ultrasound natin. Kailangan natin malaman kung anong klaseng lump yun. Talaga bang galing sa thyroid or yung sa mga lymph nodes lang dyan? So evaluate po natin. Kaya kailangan yung ultrasound to assess the architecture. Okay? Kung kailangan mo mag-worry or not, kasi hindi mo alam kung kailangan i-worry or not, hypo or hyper, kuhanan na blood test. Kaya TSH and FT4 usually ang pinapakuha. Kung normal lahat yon at meron ka pa rin lump, okay, biopsy, kung benign, wala kang aalahanin. Hindi ka na magpapanik. Pero kung cancer, kailangan gawa natin ng operation. But just to tell you that 60% of the time, the palpation or itong hand inspection, check will miss it. So yung mga bukol, 60% of the time, hindi nakukuha sa palpation alone. Kaya paggawa ng ultrasound, may nakikita na hindi nakapa. 60% of the time po. So 40% of the time, nakakapa siya.
In-advise siya na ipa-remove or natatakot siya kasi baka may mangyari sa kanya, ipa-remove niya kasi maraming mga cases daw na namamatay, kaya ayaw ipatanggal. Is it okay na we leave it like that na lang? My mom is 57 years old already. And wala na kami naging anak niya. Pero, andito pa rin siya, paano na kayo?
So yung question lang is,
Okay lang ba kung hindi lang siya patanggal?
okay lang hindi patanggal. Now, most of the time, baka nga colloid lang or benign lang. Kasi naman, kung cancer yun, matagal na, so 8 na kayo, so baka kung ano na nangyari sa mom mo, just in case hindi man yun na-treat, no? But most of the time, kasi 90% hindi naman cancerous, yung indication lang naman for tanggal is kung sobrang malaki na siya. And nagbibigay na ng obstructive symptoms. Choking sensation, hindi na makatulon ba kung taro, matukan na, nadudulunan, or kapag natutulog, minsan hirap huminga kasi minsan yung iba nachuchok kasi malaki na nga at lumaki yung thyroid. Yung neck kasi natin, medyo stretchable siya eh. It can still accommodate. Kaya kung may bukol man na lumalaki, hindi yung nagpe-press kasi nag-accommodate pa siya. But pag ma-reach na niya yung threshold ng certain size, at talagang tumutubo pa siya ng ganon, hindi na ma-accommodate ng neck, inwards na po yung pressure na nadidiin niya at magkakaroon kayo ng choking sensation. And that's the time po na we will really also recommend na kung pwede, tanggalin na lang po kasi hindi na po yun siya liliit.
Hyperthyroidism, and is it a lifelong condition?
Okay, so let's go first with hypothyroidism. Prognosis is very good. In fact, I already mentioned, it's even preventable. The most common cause of hypothyroidism is iodine deficiency, which is fairly preventable. If not, if you have autoimmune cause of hypothyroidism, you can always have thyroid hormone replacement and monitoring so that it's very much having a good prognosis. Meaning to say, patient will still maintain the quality of life. Wala namang sinasabing not fit to work or hindi na makaka-function yung patient. As long as the patient is properly treated, then there is very good prognosis, and this patient will just live as normal life as anybody without thyroid disorder. Okay? Now, next question. Is it a lifetime disorder? For autoimmune, and if you have really primary hypothyroidism pasabot, ang thyroid ang nadaot. Bisan unsa ka stimulate, kung daot na siya, di na siya mo release. So, I think from that point, I would say that the lifetime that you mean is the replacement or yung pag-inom ng gamot. Yung iba po, kapag autoimmune, kasi ina-attack ng antibody yung mismong thyroid, hindi na siya nakaka-function ng 100%. So, kailangan siya ng exogenous source just to normalize the hormone level. So, yung iba, lifetime po. So, if that's what you meant by lifetime. Lifetime ang gamutan, but yung prognosis is 100% good. Hyperthyroidism, very good prognosis also. We can really treat hyperthyroidism. It's just that there are different options to treatment. You can opt for medication, you can opt for radiation, you can opt for surgery. Depends on which is best for the patient and which the patient can afford at that point or situation. That depends on the expert opinion of the doctor.
In our experience is that patients don't know, or sometimes even doctors mistake the symptoms of disease for other conditions, particularly hypothyroidism. Remember the symptoms, yung mamagal, yung parang hindi makalimutin. I'd like to relate a personal story. My grandmother, for the longest time, parang my parents thought, maka-depressed na siya, aging. So brought her to a psychiatrist, and then wala, they couldn't work. And then hematologist, and then nagbibigay ng blood transfusion, still doesn't work. She's slow, she doesn't talk. And then finally brought her to an endocrinologist. Turns out she was hypothyroid. And she started on leucothyroid therapy, and now she does her gardening orchids. That's what grandmothers do, they like their orchids. So it's really treatable, as Dr. said, as long as you recognize the symptoms early. And that's why I'd like to encourage everyone to visit our website or to share our website, www.thyroid.ph, because really the symptoms are there and a lot of knowledge is there for them. So,
Does your website have the questionnaire?
yeah, we have a questionnaire there. We have a thyroid quiz, so we can actually take the quiz to see if the symptoms of hypo or hyperthyroidism. We also have some guide for neck check. It's a different method. You drink water and you see something like that. Yes.
So the questionnaire is also very important. Why man yun mag-questionnaire? Because this is an endocrine disorder. The thyroid influences almost all the organs of the body. Hence, if you have either lack or excess of either the thyroid hormones, dili ni siya, it's not dramatic. It develops over time. So you do not experience all of the symptoms all at one time, immediately, all of them. So they will tend to be subtle at first, and until such point that it becomes very prominent. That's why most of these symptoms you may not notice unless or until you try to ask or do the questionnaire, and then that's the time that you will recognize, oh, I have some hair fall sometimes, I have more of sleepiness now than the usual active self that I was before, and all these things. And oh, my menses are not that regular, and this way. Oh, before I used to say if I go to sleep, then I'll just bam and go to sleep. But now, it's so hard to go to sleep, but I really don't want to go to sleep. So there are things that you think it's just very subtle, but then add it all up and answer the questionnaire, then you would either really have the idea that if you're on the hyper side or the hypothyroidism side.
Has already it's either of the hypo or hyper. Then you said earlier that it affects the mens of the woman. So does it affect the fertility of the person as well?
Yes, it affects the fertility.
Yeah, even though there are no signs of lumps, right?
Of lumps.
Yeah.
Yes, it's the symptoms. But most of the time, they will have enlargement of the thyroid.
But it's possible na walang lumps.
It's also possible, especially hyperthyroid. There are lots of patients who don't have any lumps, but they are very hyperthyroid.
So for those who are having problems with their like conceiving, chances are greater na it could possibly link to thyroid problems.
Yes. In fact, if you have a history of spontaneous abortions or like that overall just difficulty really becoming pregnant, then the OB gynecologist would really also recommend that you see an endocrinologist. There are a lot of hormonal problems, not just thyroid. Thyroid is only one of them, but there are already a lot of hormonal problems that can affect fertility. And not just thyroid, but thyroid is one of those. Either hypo or hyper can affect fertility.